Welcome back. May is National Stroke Awareness Month, and we're paying particular attention as stroke is the 5th leading cause of death in the U.S. Joining us now with more on stroke and preventative measures is Vascular Neurologist Dr. Gabriel Vidal from Ochsner Medical Center. Welcome to Great Day.
Thank you for having me.
So just starting out, tell us, what is a stroke?
Well, a stroke happens when a blood vessel in your brain gets clogged up, and then the blood can't flow to the tissue that's supposed to get it, and then the tissue starts to die. Now your symptoms will reflect the function of that part of the brain. So it can certainly vary depending on what part of the brain gets affected.
Can you give us some examples?
Sure. So the most common sign that people show is weakness on one side of the body. That could be accompanied by numbness or face droop or like slurred speech. Sometimes patients don't understand what people are telling them, or they can't express themselves correctly. Sometimes they can't see towards one side, or sometimes they just can't walk straight.
So how can we help prevent a stroke?
Well, the easiest way to prevent a stroke is by having a healthy lifestyle. So if you manage your risk factors or the things that make you more prone to have a stroke, it is a lot less likely that you would have one. If you take good care of your blood pressure, your blood sugars, the cholesterol, if you eat healthy, if you don't have bad habits, you don't smoke, you don't drink too much, you stay an active lifestyle, and you eat well, all those sort of things will make it very less likely, or a lot less likely that you would have a stroke.
What is Ochsner doing to combat stroke?
Well, at Ochsner we have a program that spans across pretty much all of Louisiana and some areas in Mississippi. We provide acute stroke care for about 50-some hospitals across the area. So if patients show up with stroke-like symptoms, we can quickly institute treatment for those patients to hopefully reverse the effect of the stroke. And we have follow-up clinics at Ochsner, Maine, and at different facilities to help guide patients in secondary prevention, meaning what to do to not have another stroke and just take good care of them.
So is having a stroke, is this a genetic issue at all, or?
Well, certainly, it's not that it's only a genetic. Certainly, you can have a genetic predisposition. If your family members had strokes, it's possible that you may have strokes. But again, the most important thing is to manage the things that will make it more likely that you would have a stroke. And so you can't emphasize that enough to have a healthy lifestyle and monitor your blood pressure and your blood sugar, and that will make it a lot less likely that this would happen to you.
Is there an increased chance that you'll have another stroke if you've already had one?
Indeed, there is. Especially in the early time after you had a stroke, you're at very high risk. One of the most important things that we do at Ochsner, once the patient has a stroke, is trying to determine why did they have a stroke? What was the thing that triggered that event, so that we can tailor the therapy better to prevent the next stroke from happening. At the same time, we also work with rehabilitation and try to get the patients back to a normal functioning state.
So what are the signs that someone is having a stroke?
Well, again, the key finding is going to be sudden onset of any sort of deficits. And the most common one that you're going to find, again, is people having slurred speech or difficulty talking or weakness on one side of the body.
And this is while they're in the process of having a stroke?
That's just going to hit you right now. That's what's going to happen.
So this is something that people in the community should be aware of if they see this or notice this if they're out with somebody, is that right?
Definitely. And if you identify somebody that you believe might be having a stroke, the most important thing to do is not to wait. You call 911 immediately. We have a mnemonic called FAST that kind of like helps us remember those things. So the F stands for face. If you have a droopy face, the A stands for arm. Can you raise either arm? Do they have weakness on one side of the body? S is for speech. Are they slurring their words? Do they have a droopy face? And then the T is it's time to call 911 if you identify any of those symptoms.
Anything else that you'd like to add today?
Well, I mean, if you have any questions, always go to the Ochsner website, ochsner.org. There's a lot of information about stroke in there. There's a risk calculator that we have for our patients who visit the website.
Okay, tell us more about that. That's interesting.
Well, you just
How
go
does
to
that
Ochsner.
work?
Well, it kind of like asks you, it goes about asking the questions of the most common things that would predispose you to having a stroke. And it gives you kind of like a score at the end. You're high risk, low risk, medium risk. And then you have the information there to make an appointment with a provider at Ochsner that can help you reduce your risk of having a stroke.
So if you see high risk, I mean, is that an alarm that should go off, alerting you, make an appointment now?
Well, that would be a good idea. You don't want to wait until you had a stroke when you can actually prevent it.
Okay, all right. Thank you so much. Well, to learn more, head to ochsner.org/stroke or give them a call at 504-842-3980.